In less than a week, the federal government could shut down if Congress fails to pass a new budget or a temporary extension before October 1st. At the heart of the deadlock is a fight over what to include in the funding bill. Democrats want to extend subsidies under the Affordable Care Act, reverse recently passed Medicaid cuts, restore frozen funds like those for public broadcasting, and add new rules on how the White House can spend money. Republicans, meanwhile, are calling for a clean short-term bill that does nothing more than keep the government open until November, leaving larger policy debates for later. This standoff is what is pushing the government toward a shutdown and raising questions for millions of seniors who depend on Social Security, Medicare, and Medicaid. For Social Security, the good news is that monthly benefit checks will not be interrupted. Payments come from the Social Security Trust Fund, which operates separately from Congress's yearly budget battles. However, the shutdown could seriously disrupt the services surrounding those payments. Local Social Security offices would remain open but with fewer staff, leading to long waits that can stretch for hours. Phone lines, already hard to reach, would become even more difficult. And non-urgent paperwork, such as requests for replacement cards or detailed earnings statements, would be pushed aside until normal operations resume. For seniors navigating retirement paperwork, disability claims, or urgent documentation, these delays could create significant challenges. Medicare and Medicaid are also tied into the debate. While Medicare benefits themselves would continue during a shutdown, future funding levels for the program are part of the broader fight over healthcare spending. Medicaid, which covers long-term care, nursing homes, and medical costs for many low-income seniors, faces more immediate pressure. Democrats are pushing to reverse recent cuts, arguing that vulnerable seniors and families cannot afford to lose access to benefits. Republicans counter that Medicaid changes should not be part of a short-term funding bill and should instead be debated separately. The outcome of this standoff will not cut benefits overnight but could shape the level of support these programs provide in the years to come. For seniors currently applying for benefits or waiting on paperwork, there are steps that can help minimize the impact of a shutdown. Filing as early as possible protects your claim date, even if you do not yet have all your documents ready. Keeping written records of calls, letters, and visits creates a protective filing that safeguards your rights. And if your local Social Security office is overwhelmed, remember that any office across the country can process your paperwork. These strategies cannot eliminate delays, but they ensure your benefits are protected while the shutdown drags on. The bottom line is that Social Security checks will still arrive, but the support services around them will slow down dramatically. Medicare and Medicaid will continue for now, but the decisions being made in this budget fight could affect their strength and stability in the future. Today's debate is about whether to keep the government open in the short term, but tomorrow's debate is about whether the nation's three largest safety nets for seniors, Social Security, Medicare, and Medicaid, will remain strong enough to protect older Americans for decades to come.